the windows had all fallen out because they're deteriorated.
Sometimes
And, they're
Really?
not that one,
Oh, I didn't know
but
that. I thought
had them rebuilt
Oh, that's
by a master cabinet maker
Like
who
here?
also did this
Not
work
here in
for me.
Hawaii, but on the
Once it
mainland.
installed.
Great on the man.
from Hilo. That guy's from Hilo.
Point, Bill Crittenden, no relationship to Dan Crittenden.
Right, I don't wanna
Okay,
go
so
out back to work.
he made this custom cabinet from bending plywood
Oh my God.
to match the,
So I sort of
Oh.
generalized it, it may not be true.
Well, even if it's happened once, that's.
Yeah.
there's a sink, see how it's curved? We moved the sink.
Probably not.
And then so he built this cabinet to accommodate the shape of the sink.
They always tell you how.
And then,
So you rehab the sink?
Honolulu, you know, like that. Right.
Interesting.
then they built this whole little custom cabinet thing. And then, this is what, we have the floor tile covered right now.
I see what you're saying.
I am too,
Yes,
yeah.
of course, you know, that cost me $2,000 just for that piece of quartz. Like
It looks
that, you know.
nice though, but it has the backsplash and everything. And then the custom piece right back
Oh,
there.
no backlash, that's still the flat part, see,
Really?
all flat, no backsplash.
I didn't think
And
anybody
actually,
was
this
becoming that, I
is
knew.
wooden backsplash, and this is like, this, dropping stone.
Wait, so this is not a backsplash? Not- Is that
No,
not?
you have to follow the lines, but it's hard to tell because it goes out the corner.
Well, there
It's
are-
all just flat. You can tell, I see, you're looking at the reflection, that's why. Yeah, but this is, so that's my kitchen.
Did you have to have the sink refurbished?
Are you finished? They said it was okay, I'm gonna trust them that they were. So we went from the chimney, checking the chimney, to checking, all the foundation, replace lumber, foundation.
Oh, you have to lift.
No, the chimney. And that's my master carpenter.
You're so lucky you found something.
Yeah, look, this delicious, the damage.
Hi, I'm listening.
Hi.
I know.
Holy moly, what happened here? It's all turned, I'm sorry.
Well, I don't want to be my brother Tim, but Tim managed the property.
Only Elliot.
And instead of, fixing the roof, Tim just cut a hole in the floor, but it wasn't good enough, the water had spread and damaged all the flooring. So we went out to meet the house, we took a picture of. But, oh yeah, we just, fixed the whole thing.
Just came back.
Are these originals?
All original.
Oh, nice.
1914, this was built.
I thought maybe.
I'm so excited, this is such a great project. And Bill, Christensen, the cabinet maker, he rebuilt.
Yeah, I should get that guy's name, because we have an old house, older, well, our own house, but we have an older home.
He built this.
Oh, so he knows how.
I have.
It's like I tell you, he built,
You're like curved.
Wow.
Wow.
5-6 years.
I mean, this to me, I can do this kind of work, but I don't have the time.
But
He knew a little
he has
bit,
all.
but it doesn't matter, because it looks good, most people won't even know. And it'll function perfectly, you know, and,
Yes, with the
it's
frames.
all good. So he had to replace that whole one.
So you have to open it up, construct it, and then put it back in.
Yeah, so I did.
Well, that one was totally missing, so he built this whole thing
Oh, you
from
built it,
scratch.
okay. But you had to remove the pocket, right? Storage, is it good?
Oh, this particular ones, were either fixed in place or swing. This one was a pocket
I
one.
also.
Oh, okay. So
And that one has to be rebuilt, so it looks like
they don't
that.
make it like that anymore.
No, you cannot order that. You have to go get someone to build it for you. Unless you get really lucky and you're down at Home Depot, you find these exact dimensions, and you just kind of,
So my.
make some adjustments or whatever, and you can throw it to your wall. But otherwise, no can.
Thank you for the building, that you're doing that. Because you know, so much probably love and attention went into that whole 20th,
You know,
1940s.
I'm 68 now, yeah, and when I was age 20, from age 4 or 5, I always wanted to be a carpenter. And then at age 14, I wanted to be a laser boy. So from age 14 to age 27, I made surfboard. And then I was from age 22 to age 27. And then I get tired of being poor, so I went to law school. You know, and then no. So
It's still in your heart you want to do this. You know?
well, I renovated 2 properties already. This is the third one. And then, because I can't see it, going to waste, like that. This place has been so dilapidated and neglected.
No, but the thing is, it has so much history, right? So now
Oh no, it's wonderful. We're gonna turn it into vacation rental.
yeah, people like it.
Oh, yeah.
If you tell them the story, everybody wants that story.
No, this is the story I'm gonna tell them. I'm gonna tell them that. Hey, look, this is the story I'm gonna tell them right here.
Get the real story. You're gonna tell this story.
Tell them this story. Tell them this story. The property is named after the original ones, the Colvilles, and then it's a historic home. It was built in 1914 with original lava rock walls, and we have it's a part of a 3-acre parcel of land that's still mostly in conservation, and we have very rare species of birds that live on the property, and then I'm gonna tell them not tell them about this.
You have to tell them that.
Clean up my brother Dickie. Kirk is my construction guy.
You're lucky to have somebody.
See, look, this is the condition of that kitchen window.
So it was being rented out?
No, we're gonna finish in about a month and a half. This is what the room like before. This is a very old style of look, like the early the teens and the 20s. This color kind of like walls now, but it's too dark. You gotta change it. You gotta change it. You gotta change it. This is what they're doing.
Please, you have to tell me what's okay.
Ben.
Okay.
Yeah, he's I'm 68, he is 75.
Hey, wait, guys.
Oh.
Hey.
Come on.
My seat. This is the 4th time that Dr. Eileen Hilton has come to talk to us about Medicare. And every time that she comes, the room is always, the seminar is always sold out. So that speaks to either one of two things. Either we are old and we're slow learners, or this topic is really important to us, that it's very complex, that Dr. Hilton knows it very well, and she can explain it to us in terms that we understand. Dr. Hilton is a medical doctor specializing in internal medicine. She's a former professor at Yale Law School, Medical School, and emerita, still professor at Albert Einstein Medical School in New York City. So please join me in welcoming Dr. Hilton.
Thank you, and thank you for inviting me 4 times. I see some familiar faces, so obviously it wasn't fully understood the first 3 times. So I'll try to make it less boring for those guys by telling jokes or something, because they probably remember all of it, and I will not call on them to answer questions. By the way, if anyone has questions, and they're particularly about themselves, afterwards, okay? If it's something general, interrupt me, okay? All right, now I think I have the hang of this thing. Okay, so we're going to talk about 2018 going into 2019. We have some updated information on 2019, but things are changing every year. Deductibles are going up, premiums are going up, and some of them are actually going down. So the typical, well, that's good. Okay, this is how many of us look when we start getting all of this, what I call junk mail, which I always throw out. But I probably should have kept some of it. Some of it is good. This stuff is good. You know, there's some interesting in it. Any of you guys get this one? Medicare and You? Okay, when I first got it, I started to cry. However, I threw it out immediately. It made me feel better. And I just recently gave a talk to the doctors at Straub, who, like me, knew nothing about Medicare. at the point at which they needed it, and here they were billing patients on Medicare and everything else. We know nothing about billing either, especially if we're in academic medicine. You know, you see the patient and someone else does the billing, so it takes us a while to pick it up. This is the response they had after this lecture. Are they kidding? How could anybody understand this stuff? So I'm going to try to walk you through it and make sure you understand it by the time you leave. Okay, the overview is, what is it? Do I have to enroll at 65? How much is this going to cost me? Can I keep my current doctor's critical question, especially on the mainland? And how do I choose a plan? Okay, so everyone knows it's government health insurance. And it's a safety net for seniors. It started quite a while ago in the 60s with Lyndon Johnson, and it's for age 65 and older. That could change. I haven't heard that yet, but it's been rumored. The reason it's so confusing, it's like an alphabet soup. First of all, I want you to think of parts versus plans, okay? There's part A, B, and D, and now C, okay? Those are parts. That's the big overall part that we're talking about. And then underneath some of them, there are plans. So when we talk about supplemental, we're talking about A through N, okay? So that makes it even more confusing. We're going to start historically with original Medicare. Again, Johnson, I think it was in 66, signed off on it. It has these parts, okay? Part A, which covers hospital. We'll go into more detail on that in a minute. Part B, medical, which is doctors, etc. Supplemental is the gap insurance. And D is drug. Drug insurance didn't start to the mid-2000s. Before that, you were on your own. Over on the right-hand side, Clinton decided to do a public-private partnership with the insurance companies and said, you take some of these lives off our hands and we will give you a bonus every year for every life you take off our hands. So that's part C. This is the Advantage plans that you get tons of mailings on. HMSA sends, Kaiser, etc. So we're going to discuss these separately. The first one is Part A in Original Medicare. It's free for most people. If you've worked 40 quarters, which is 10 years, it's free. It's also free for some people under the age of 65 if they're disabled and some other various scenarios. People who haven't worked but whose spouses have worked may get it free as well. So it's always worth asking if they try to charge you because it could be substantial. It's $421 a month if it's not free. So we want you to make sure that you know whether you have to pay for it or not. Almost everyone here, of course, will be free. The deductible is in the $1,300 range. It goes up and down, but primarily up. Okay, so it could be about $1,330 or $1,400 this coming year. Hospital insurance is covered, meaning your inpatient stays. Skilled nursing facilities is also included. Does anyone know how many days they'll pay for a maximum?
90.
100, almost. You almost won, okay? So 100 days. However, do we almost never get 100 days? When they almost never. Very rarely will you see them pay up to 100 days. Typically, what we get called for are patients who are getting tossed out of the nursing home after 3 weeks because at a certain point, a 0 to 21, they're getting paid for by Medicare at the highest amount, and then it drops down, and there's a significant copay per day. So the social workers call and go, get your mom or dad out of here. They're fine now. The person can't walk, they can't speak. They're basically just perfect, and they send them out. So we end up fighting them and appealing, and sometimes we win, but it's a mess. Skilled nursing facility coverage is under A, but it's not long-term care insurance. People make that mistake. That is not covered under Medicare at all. So if you haven't purchased it, I don't even know if it's for sale in most places anymore. They have these new things out where you basically are putting down a lot of money and then basically getting some of it back if you have to go in a nursing home. but a lot of the long-term care companies have gone out of business, out of that business. They may have stayed in the insurance business, but they don't do well in long-term care. They ended up miscalculating how many people were going to need it at one time. Hospice is covered, and some home health equipment. Okay, Part B is doctors. Some meds, before Part D came in, chemotherapy meds, which was super expensive, were covered. Okay, so it wasn't like that massive hit of cost when you had chemotherapy and you weren't covered. But now there are some oral chemotherapy meds. Some of them are not covered under Part B. We hope they're covered because we can get a lot more money, to help us to do that. And that's the ones that are given in the doctor's office or in the hospital, in the IV infusion rooms. Some home health care, and by home health care, I'm not talking about long-term care where they come in 3 or 4 times a week and will help you out, or so many hours a day. It could be a nurse coming in after you've been discharged from the hospital. That's typically what goes on, and it doesn't last long. Physical therapy is covered. OT, PT, physical therapy, that's all under Part B. And durable medical equipment. I remember years ago watching these very fancy looking wheelchairs going up mountains, electric and whatever, and they go, you can have this too. Do you have Medicare? This is free for you. Just sign up with us, and they would actually deliver a wheelchair. I don't know if they delivered the electric one. That was just probably a teaser. But they would deliver wheelchairs to the patients. And they still cover that. Preventative services. Do you have any idea what preventative services are covered? Flu shots, absolutely. Anything else? Shingrix. Okay, that's a really good one because we have a handout over there for our recent newsletter, which if you don't get our newsletter, you should sign up. We don't use it for advertising. All we ever do is send our newsletter to you. Okay, so the newsletter has a whole article on who should get Shingrix. I'm not going to speak about that right now, but the bottom line is, in the old days, the shingles vaccine wasn't covered at all, okay? And Part B doesn't cover the Shingrix. No, it covers flu, pneumococcus, those kinds of very common vaccines. Does it cover travel medicine vaccines? No. Why? They're expensive, okay? Yellow fever is like $100 a pop, at least it used to be when I gave it. They do not cover it. They figure if you're rich enough to go to Africa and need a yellow fever vaccine, you are rich enough to pay for it. So that is not covered. And I know there are travel medicine centers here, and they tell you it's not covered by Medicare.
How about just the regular vaccines like DPT?
DPT is considered preventative and is under B, pretty much. All of the cheap stuff is under B. Varicella, I got a call from the mainland last week. Someone was in the office, somebody I'd helped get insurance, was in the doctor's office, and they were getting a Shingrix shot, and they said, why am I getting charged $40? Didn't you tell me if I had this, and this plan, I would be fine? Nobody would ever bother me again asking me for money. I said, well, because that's not covered by Medicare, Part A, B, whatever. And it is covered by D, and 40's cheap. Take it and run, okay, because they really are expensive shots. So preventative services are covered to a certain extent, but not every one of them. Okay, Part B premium. This went up this year, okay. Based on annual income, it ranges from $134, unless you were grandfathered in a much lower rate, and I don't need to get into that because most of you are not, to now it's up to $455. Why did it go up to $455, and why is some people paying more than others? Did anyone ever hear of the income-related Medicare additional amount that's added in? It's called IRMA. No? Dead silence. I recognize some of you people here. You've heard this before from me.
Refresh your memory.
In there. Why do you think they did this? They were running out of money, so they said, let's tax the rich more. So what they did was they had this unreadable thing, but it's on your pieces of paper there. If you have, this is 2019, and because they cut taxes, okay, this went up, okay. But in 2018, it was cheaper. We didn't have this little one down here for 455. They didn't even bother with anything over, I think it was 320,000. They were charging 428, and that was it. Okay, so this is joint. This is single. Okay, so if you're a couple and you're making over $750,000 between the two of you, you're going to pay $455. If you make under $170,000 for the two of you, you're lucky, you make $134. What's it based on? Your income tax return. Line 37, if you want to look it up on your 1040, which is the modified adjusted gross income. The modified adjusted gross income is usually less than your gross income because they're taking off municipal bonds from Hawaii interest, whatever. And they're also taking off capital losses if you had them, etc. So there are all sorts of ways to try to modify your income so that when you reach Medicare age, you do not pay lots more. And boy, this is significant. This is per person, $428, okay? That was the top one last year. That's already before you bought anything else, any other premiums, anything, right? That's what you're just paying for Medicare Part B. Okay, now, in terms of the IRMA, we have several ways that we can try to decrease it. But the one thing you have to be aware of is it's based on your income that they can pick up. How could they figure out what your income is? Well, they go to the most recent one they have. Most recent one, because most people have filing delays, etc., is usually 2 years prior to when you're enrolling in Medicare. So if you're enrolling in Medicare in 2019, they're going to go to 2017, and they're going to look at that line 37. So some clever people said, well, I'm going to make sure my income 2 years before I'm going to go on Medicare is going to be lower. So this is a way of lowering your modified adjusted gross income. There are several ways. First of all, if you are going to lower your modified adjusted gross income, you don't want income, right, that year. You want to hide it, look at ways to get rid of whatever. So you can use, if you need cash, Roth IRA money, if you have a Roth, because that is not taxable. Okay, it does not go into the modified adjusted gross income. You can manage your capital gains and losses. So if you have losses that you want to harvest before the end of the year, it's a good idea to do it. Okay. Time the receipt of income. If you're selling a house in Hawaii or in big, we have seen their IRMAs go skyrocketing because they sold a house in Hawaii. They bought it for $200,000 in 1950, not even 1980, whatever, and now it's worth millions. And here they go. We've got this huge amount of capital gains. You could try to time the receipt of income. It doesn't work very well, but some of you tax lawyers here might tell me how to do it. If you're still working, contribute to your 401k. That does not go into your income. It lowers your modified adjusted gross income. So if you don't need that cash to live on, put it in the 401k. There are some other tactics. When you're 70 and a half, you're going to be forced to take a required minimum distribution, whether you want it or not, okay? It can really, if you have $1 million saved, you're talking 30,000, whatever, that's going to be stuck into your modified adjusted gross income if you take it directly from the IRA and put it into your checking account. This is something I found out recently. You can directly donate from your IRA to charity. Okay? Let me ask you, do any of you know about Hawaii Community Foundation, where you can give them money and then you decide whenever you want to? Or even Merrill Lynch does it, or any of them, Vanguard does it. You can designate which charities over the years, which you get the full write-off in the year you give the money. Are you aware of this?
No.
Okay, so it's a designated beneficiary account. It's really great, except you cannot donate the money coming from that kind of account. You cannot donate the money, I'm sorry, you cannot donate the money from your IRA to pay your minimum required distribution to yourself into that kind of account. It has to go directly to the charity. They're trying to change that law because it makes it a lot easier for people to give charitable donations. And then, of course, if you're going to donate stocks that are appreciated and not cash to charity, that is a better write-off. Okay, is Part B required? Now that you know you have to pay so much for it, is Part B required? The answer is right in front of you because you're all turning the page. No. Okay. We give you the hints and then we... Okay, but late enrollment may cost you more. It's 10% for each 12 penalty, 10% for each 12 months that you should have signed up for Part B but didn't. And it lasts for how long? That 10% penalty. Forever. Well, for life, your life, not forever. Okay, that's forever for you. Okay, so for instance, if you're 30 months late, the penalty is going to be 20% because you had 2 full 12-month periods out of there.
So when are you supposed to sign up for?
That is wonderful. Are you my shill? This is when you sign up for it. The initial enrollment period is 7 months. 3 months prior to your birthday, the month of your birthday, and 3 months after your birthday.
What birthday?
65th.
What if you have elected to defer?
And that's the next answer. Okay. Sorry. Okay, you should write my next talk. Okay, so we always tell people 3 months before because there are so many people signing up now that you end up getting delayed sometimes in getting your Part B. And we've had some real nightmare stories where people were uncovered for a month or so because they were so backed up with getting a Part B. Can you defer your Part B enrollment? He just gave you the answer. Of course you can, but only under certain circumstances. You or your spouse are still employed with employer coverage, and the critical word is employer coverage. Okay? It does not mean COBRA. It does not mean retirement plan. DOD retirement plan, no, right? That is employer coverage, okay? None of those things count for you not to have a penalty if you don't sign up on time. When you leave or your spouse leaves employment, then you have an extra month. You have 8 months to sign up for the first time. And the first time sign up is important because if you don't sign up on time, aside from the penalty you're going to get for the 12-month periods that you didn't sign up, you have to wait till July 1st first of all, you have to wait till open enrollment to sign up, the next open enrollment, and then you have to wait till July 1st until your stuff kicks in. So even though you sign up at the next open enrollment, your coverage won't kick in on Part B until July. And we had a patient like that, and that was a mess because he got sick before it kicked in. Yes?
I have 2 questions. Employer coverage last year meant the employer has to have, I think, 50 or more employees.
No. It could be any employer coverage. A lot of attorneys have used us, and a lot of them are their own employers. And one we had World War III with Social Security, who did not understand because he was the letter of the law, so to speak, and talking about how it was a private insurance company. They hear private, they go, not employer. So there was a delay. And you do not want to say that. You want to say, yes, I have employer coverage. End of discussion. I have a good reason. And we send you the forms that you need to submit, the online forms, if you delay enrollment until another age. And go ahead. Yes.
A lot of lawyers practice with firms as corporations. So who's the employer? The individual corporation or the law firm?
Are you talking about the groups that lease employees?
No. Just a lot of law
No,
partnerships.
it doesn't really matter
So
because all you have to say it's employer coverage because it's a group employer coverage, okay? the leasing companies also would qualify for that. So if you're in private, some of the docs have them, where they're in private practice and the insurance rates were so high for their individual coverage that they went to one of the leasing firms, and that leasing firm leased them their own selves to, and that was a big corporation, and they got lower rates on their insurance, but they're sort of like getting more expensive, so they're not as big a bargain as they used to be.
Is there a deductible for Part B?
You mean, can you deduct your premiums?
No, I mean, when you submit your.
Oh, yeah.
What is the deductible?
183 this year. We don't know for 2019. But we have ways to get around that. We have our ways. Okay, so the supplemental insurance is one of those ways, okay? This is really great crowd because you will predict what I'm going to say on the next slide. Okay, so the deductibles are covered under some of these supplemental policies, etc. How much percentage is covered of your hospitalization under Medicare and your doctor bills? What percentage?
80%.
I heard it, 80%. Okay, so the 20% extra is the gap. Medigap is covering that stuff if you buy it. That is offered by private insurance companies. In Hawaii, there are 12 that offer it. They have, now we get to the confusing stuff, they have plans, okay? They have plans A through N. See, the reason that I put this up here is because this is probably the most confusing part of Medicare. You've got Part B, you want to cover a gap in Part B and A, and now you have to go to a plan, okay? Every single plan is the same in terms of what it covers if it's an A. Every A is the same, no matter which one of the 12 guys you choose to cover you. So some of them will cover a little bit, some will cover the full 20%, some will cover everything plus bells and whistles plus international travel emergencies, etc. The cost is the only difference, okay? So how is the cost determined? They have it by rating, either community rating, which is the community as a whole, okay, all comers, some are sick, some are healthy, etc. Or they have it by age attained when you sign up, or age attained, period. Not good. Okay, so we usually either go for community rated or age attained when you sign up. There are premier plans. F is the fancy plan, going away in 2020. Congress decided you guys would not have enough skin in the game if you had first dollar out-of-pocket coverage, which is what F is. So what they did was they voted they have to have more skin in the game. This is why people are going to the doctor so much. They love going to the doctor, and they love sitting in the offices waiting, and they don't have to pay a thing when they have an F plan because it covers everything, including, the copay in the doctor's office, the deductible, everything. And if the doctor who is allowed to do this decides to charge 15% more, which Medicare will allow him to do that, it covers that too, okay? So,
Are those monthly figures?
yes, on top of the 400 and whatever you're lucky enough to have made an income tax. And this is from this year's AARP United Healthcare Supplemental Plan, which is the only community plan in Hawaii. However, I was pleased to find out, because we price them all, 12 of them, and they're outrageous, a lot of them, especially the age attained. I was very relieved to find out that Transamerica has gone down, this one. And USAA is liked a lot too, but that's not rated very well. So it's a little more expensive. But Transamerica was very competitive with United Healthcare's AARP plan this year. And are any of you married to doctors? No, you better go find one. Because this, where it's 139 around that for a non-doctor, a doctor signing up is 90-something bucks, I think 94, right? So I told my husband, aren't you lucky you're married to a doctor? But he's a doctor too, yeah.
Are you able to comment on why USAA is not rated well?
No, it is rated. USAA is rated fine.
Oh.
It's rating how they decide your price. They decide it based on age. So age is always bad. You're always getting older. Yeah, hi, how are you?
If you're in F, are you out applying or are you grandfathered in?
Very good question. You are grandfathered in. So what we do is we tell people the plans, I'm going to go back in a second. The plan G is going to replace F essentially because G covers every single thing F does. If you don't want to get grandfathered in, if you want to move, okay, G covers the exact same thing, but it doesn't cover the deductible, the Part B deductible. Now that's scary if the Part B deductible starts skyrocketing, okay, but it hasn't in the last 2 years. This one, where am I looking? Okay, over here, the G plan is about 118 bucks. The deductible is 183. You're not saving a fortune. You're saving about, if you don't take the F, if you take the G, okay, you're saving about 80 bucks a year, by going on the G. Some people have chosen to take the F because they don't want to be bothered worrying about whether they've met their deductible or the person behind the desk in the office actually calculated it. They don't know. I've been in the derm's office watching nightmares at the front desk, guys who have, plans that have a deductible and they've met their deductible and they're not supposed to be charged anything. The girl behind the desk doesn't know they've met their deductible, so she's charging them. So I get up and open my big mouth and say, don't charge them. Yeah.
The gap only covers precisely that gap. It doesn't cover non-covered.
No, there's some.
What about shingles, for example?
Okay, shingles is on Part D, remember. Now we're on plans. This shingles is on Part D, okay? Nothing on Part D has to do with gap. Nothing. This is strictly Part A and B. Extra stuff, it covers emergency in a foreign land, ER stuff. Keep all your receipts, and when you come back, you can look into that.
So Part F has a deductible too?
No. Part F is first dollar out of pocket. It is called F for the fancy plan. F, fancy. Okay.
So is that amount fixed from?
No, goes up every year.
How about Irma? Does it Irma?
Irma isn't touched by this. Irma is going up by income.
Yeah.
Okay.
So every year you have to calculate based on your income of that year, or 2 years.
You don't have to calculate anything. They do it for you, unfortunately. Yes. So, and if you sell your house, And the one thing about Irma that's interesting is they didn't just stop at Part B. Okay. They went to Part D too. They said, there's no way we're going to leave these rich people alone. Part D people who make a lot of money are going to pay $75 a month extra on any drug plan they choose. Most drug plans are going down this year in 2019. The average drug plan cost under Medicare is going down to $32 or $30 a month. But on top of that, you've got to tack on $70 which is your Part D Irma, if you're lucky enough to make that much money. Yes.
How much time should you need to do all of this enrollment in advance of your retirement? How long?
3 months, I would say, minimum. Yeah, you don't want to go uncovered. 3 months. Yes.
I have a question about that 2-year look back.
Yeah.
So is that from when you become eligible at 65, or if you defer enrollment when
The latter. Right. When you're going to enroll, whether it be 65 or you quit your job or your wife quit her job and you're not got any employer insurance anymore, that's when you do it. Yes.
So, if you're doing the Medicare program, can you see anybody who accepts Medicare?
Correct.
Do they have to accept your Medicare insurance?
No. Well, some of them say they don't accept United Healthcare or something like that. But with Medigap, they don't even know that because it's invisible. What it is on the back of the Medicare claim form. I never knew this. I only worked in medicine for 20-odd years. There's a thing that says supplemental insurance. The biller puts down a 5-digit code, I believe. It is invisible, it is a pass-through, it is a crossover. So it'll go right into the payment to the doctor. So the doctor may say, I don't like this, I never accept it, and they've been accepting it for years and not knowing it.
And do doctors accept Medicare?
That's another discussion we're getting to. Okay? Yes.
So theoretically, if you have employer coverage, and if the coverage is pretty good, you don't need to pay for Part B,
That's correct.
you don't need to pay for the Medicare, and
Correct.
you don't need to pay for Part D.
Correct. If the coverage is very good, and we're going to get into that. I do a lot of employer coverage, and I've been appalled lately. I don't know if yours has changed, but a lot of other people's have changed, okay? You're not first dollar out of pocket. You're always co-paying. If you go get an MRI or a CAT scan or anything like that, number one, you're co-paying, and number two, you've got to get pre-approvals, or the doctor's office has to get the pre-approvals, and that can be World War III now. Yes.
We know that the Part B only pays 80%, but Part A, that pays 100%,
100% of,
whatever it's covered.
right, of the coverage, but Part A has a deductible, so Medigap covers that Part A deductible. Most of those plans cover the Part A deductible. Yes.
If you would be retiree under TRICARE, we're told that.
You have to take it.
Well, what's that?
You have to sign up for Part A and B.
Oh, A and D.
Correct.
Okay.
TRICARE
Well,
mandates that. No, that's your choice, but TRICARE has their own D. They just switched to Walgreens, I think, from CVS or vice versa, but it's a very good coverage. It's excellent. Are you TRICARE?
Yeah.
Lucky puppy. Okay. You got a lot of good stuff on TRICARE. Okay, let me move on. Is Part D required? Cheat, look at your next page. No, it's not required, okay?
Oh, thank you.
Nothing is ever required except if you're on TRICARE or EUTF, which requires B, but then, is anyone here on EUTF? Anyone have a teacher wife or anything like that? No? State employee. Okay, so just for you, EUTF will require B, but they will reimburse your B, okay? And there's all sorts of tricky things about that, so you need to know. Late enrollment's going to cost you more, but not a lot more. It's very cheap. It's like 1% of the national base premium, which is, $3 a month, whatever. Part D is prescription meds, plus remember that vaccine and several others. They may have a deductible, but they may not. Because you'll see advertisements, oh, we have zero deductible, oh, you don't pay anything. It is subject to IRMA. Remember, they go after that one too. And there's something called the donut hole, which I'm not going to spend much time on because it's quite confusing, but it's going away. So it doesn't really mean much anymore. The donut hole used to be up to a certain amount, much lower than that you would spend on drugs. You would be paying 75 or 70% of the brand name cost. Now it's down to 25%, which is what it should be, right? The only thing that's still a little higher is the generic drugs, which are cheap to begin with. So the donut hole, the dreaded donut hole, back in 2010 was governed out of existence starting in 2020. Right now, it's almost like non-existent because 25% is what you paid for them before the donut hole hit. So it really makes no difference, but I'm mentioning it not for historical perspective because it's still quote here, but it will be gone. Okay, once you've hit 5,100 in a year, this year coming up, in 2019, you're in catastrophic coverage and your cost goes plummeting, okay, going down to 5% coinsurance or even lower than that, depending on the drug. So, but you have to spend $5,100 a year on overall, including, and that's a lot of money. So the donut hole at this point is moot because most people won't be in that boat. In the past, our patients who were on not chemo, but some very expensive drugs, okay, rheumatological drugs are very expensive, and those get into the donut hole by month 2 or whatever. Now the oral chemo drugs are $120,000 to $200,000 a year for each one. They're giving people 2 at a time. you figure it out. They'd hit the donut hole in January. So, but that's good. Then they don't pay as much anymore. Yes.
Now, the catastrophic coverage, where does that come in? You buy that separately?
No. That's what the government supplies that.
It's part of Part A?
It's part of D.
D. Prescription drug.
Prescription drug.
But it covers more than drugs?
No, only drugs.
Only drugs.
Only drug. That's where it's very confusing, because even in your Advantage plans, which we're getting to now, and why we say the drugs you're on are more important than anything, and the drugs you're going to be on are more important than anything, because next year your drugs in 2019 could change. I'm a doctor. Edwina, my partner there, Wave, Edwina is a nurse. We go over every drug they're on, every disease they have, every family member's disease, and we try to figure out what is going to happen in 2019. Because if you are not aware of some of these expensive drugs, like for macular degeneration, rheumatoid arthritis, hepatitis C, all of these things, and the person's taking advice from you to take a certain drug plan, and none of those drugs are covered. So we'll run the drug plan through 30-odd companies, and then we'll run it two ways, one with the potential drugs and one with the the ones you're on right now. Okay. Now we're up to the Advantage plans. They were a great advantage, and some may still be, but it's changed. The Advantage, remember, was Clinton in '92. He made the public-private partnership. These are prefix, okay? They combine A, B, and D. They're very similar to your corporate plans. Pre-approvals are required for virtually everything. Over here, we don't have, as a doctor, I can tell you, we don't have to worry about pre-approvals. We don't have to worry about any of that. The only time we have a pre-approval, believe it or not, and it isn't us, is for physical therapy and occupational therapy and speech therapy. And that's done by those therapists, not by us. We have to pick up a phone, never, to ask for a pre-approval on these. These supplemental plans are automatically covering the 20% that the Part B doesn't cover for those kinds of things, and testing, all the testing. So the Advantage plans are prefixed, as I mentioned, with A, B, and D. They're offered by private insurance. Does everyone know the difference between an HMO and a PPO? There's a good crowd. Nobody's admitting that they don't know the difference. HMO is, not only do you need pre-approvals, but you can't go to any doctor you want. You've got to be funneled to the doctor that they want you to go to. Kaiser is an HMO. There is no PPO in Kaiser. You cannot, I just got a call today, somebody wants to get their care on the mainland because they have a very unique, odd disease that I actually did hear of before, but that's the second case I've seen in my life. And they want to change because Kaiser won't let them get the treatment they need at the leading place, which happens to be Johns Hopkins, because that's not a Kaiser hospital. I mean, they may let them go there under duress, being threatened to be sued, etc., which is how they got one visit there, but they need continuing care there. So they now are in open enrollment coming up, and they want me to figure out how to get care there, okay? How to get care at Johns Hopkins on the mainland, because they can't get there with a Kaiser thing. Okay, so PPOs, you choose any doc you want, you go to any subspecialist you want. It's a preferred provider organization, and there is no gatekeeper, okay? You don't have that gatekeeper issue. Around here, you have gatekeepers only because they will make you. If you call if you call an orthopedic surgeon who's never seen you before, he'll say, well, where's my referral? Okay, so that's automatically you're getting a gatekeeper issue, okay? And so you call your primary, and the primary goes, I don't like that guy. I want you to go to this guy, whatever. He's my brother-in-law, whatever it is. I've seen it, believe me. So I said, well, you can go wherever you want on a PPO, right? But then they call us and they go, can you get me into this doctor? And we go, yeah, we write up the history, we have the referral, but that's how we get business, so I don't want to say anything too bad about that. Okay, so Part A, B, and D are all rolled into one. You also have bells and whistles. used to have lots more bells and whistles. Gym, vision, dental, those were great, okay? They're gone in most of them, okay? HMSA, I think, brought back gym in one. We check every year. We have what we call the Lost Weekend, which is the first weekend, I think, after the 7th of October, when they come out with all the Advantage plans, and we go through every single Advantage plan on every island, right? And we say, did they do this? Did they do that? What's the premium? And are they giving the gym? When they're giving the dental, etc. Sometimes they bring it in and out. The problems with them, they have HMSA. Let me just tell you this. HMSA is the 700-pound gorilla in town. United Healthcare, Humana, and Kaiser. Those are your Advantage plans to choose from. Kaiser is what kind of a plan? Yay, you guys are learning. Okay. Okay, Humana has HMOs too, and so does United Healthcare, but they also have PPOs. Yeah.
If you're choosing a Part C plan, you also need Medicare?
No, that's all in one. Everything is rolled into one. However, although it's a one-stop shop, and although it has the frills, some of them, MD acceptance of some of these plans is really going down. Why? What did I mention that we hate? What do we hate to do? Pre-approvals, right? It's like you need a separate office staff just to do pre-approvals. It's a nightmare. And what else do we hate to do?
Bills. Billing.
Yeah, well, first of all, every single one of these, right, require co-pays. No, there isn't any no co-pay Advantage plan. Okay, so you're going to have a $7 office copay or a $10, whatever. A Plan F is like, leave my office, have a nice day, don't even stop at the desk. Okay, that's basically what it's supposed to be. There are economic pressures. So what did they do when 2010 comes, ACA comes in, ACA has to help pay for itself, right? What did they do to the kickback they were giving every single insurance company for each patient's life per year? They decreased it, okay? So Clinton said, I'll give you a bundle of money to take these lives. The bundle of money is now a trickle of money. So now, where do you think they passed it on to? You, okay? So you are now paying extra. In 2010, what do you think you were paying for day 0, day 1 through day 7 in a hospital stay? Take a guess. No, you're never paying nothing on an Advantage plan. Okay, what do you think you were paying? 100. What do you think you're paying today? Take a wild guess. Oh, you guys are really sad. No. No, there would be war in the streets, blood. Okay, $6,000 copay for 6 days? No, you're paying a lot. You're paying up to $400. Okay, same exact stuff. PPOs, all of them have big copays now. See, you don't see that because you see premium, 0. Humana has a 0 premium policy. 0, right? What's the copay for hospital day? $380, right? What's your doctor copay when you go in? These things all went up. The premium, I think there was a big hue and cry when HMSA raised their premiums for their complete plan. At one point, they raised them so high that the insurance commissioner wouldn't approve them, so they had to discontinue all of the HMSA Advantage plans. This was 4 or 5 years ago. Everyone was hustling in the nursing homes, trying to get the patients in the nursing homes on a different Medicare plan. And it ended up that what they did was call it complete and plus, whereas before it was this or that. I don't remember the names anymore. But basically, the names were different. So they changed the plan. But what happened was is the actual item by item, which is why we call it our Lost Weekend, item by item, each thing changed. Not for the best, for the worst. When it changes for the best, we mark it green. And when it changes to more expensive, we mark it red. It was a sea of red for several years and still is. So you cannot say for sure that these plans are cheaper. In what case would these plans be cheaper? Think about it.
If your IRMA is high. If your IRMA is high,
No, the IRMA applies to the Advantage plans too.
It does?
Exactly the same. It's Medicare charge. It has nothing to do with the individual plan you're on. That IRMA is always the same. Why? What other one? I heard somebody say something.
If you're really healthy.
If you're really healthy. If there's no drugs and there's absolutely nothing wrong with you and you're really healthy, these plans can be really cheap. Okay, if you're not going to go into the hospital, if you're not going to use doctors, if you're not going to use drugs, they're great. The problem is, how predictable is that? That's one thing we operate on, and we put people on these plans if it's real predictable. In their case, like daddy's 106 and mommy's, whatever, and nobody in the family has had anything except a cold, maybe once a year. That's a very good risk, okay? We look at it risk-wise. And nobody's on any drugs in my family. They died in their sleep at 200 or whatever it is. Those are the kinds of people that do very well on an Advantage plan. What's the downside of going into an Advantage plan and staying in an Advantage plan past the age of 67? Or actually past 6 months after you enroll in the plan. The rule is in Medicare Part B with Medigap, and this is the most important thing I'll tell you, okay? If you pass the 6-month point and you're in an Advantage plan and you get something bad happen to you and you want to go next year into open enrollment and pick a Medigap plan along with original Medicare, you are not guaranteed acceptance into the Medigap plan. You're not guaranteed that 20% coverage. The federal government mandated that any insurance company that wants to be handling Medigap has to agree to accept all comers in that first 6 months. No medical questions. Zippo, okay? They ask you things like, are you on dialysis? I think that's it. I don't think they ask anything else. When you go over that 6 months, and they're getting more and more strict about it, because they used to wait till 2 years. When you go over that, they ask you everything. I mean, pretty much everything. So many people have had episodes of atrial fibrillation, etc. Those are the kinds of things. I just pray they had them 3 years prior, because that's the cutoff on the Advantage plan, on the Medigap questionnaire. So you have to decide, if you don't like original Medicare and your Medigap plan, you can move right back to an Advantage plan, no problem. They'll take you. They won't ask you any questions. But if you want to move the other way to original Medicare with a Medigap plan, you will be questioned after 6 months. If you're lucky, they'll wait 2 years, but it's not a guarantee. You're not a guaranteed acceptance. So if they don't accept you, they reject you outright, or they can accept you at 2 times the premium or more. Yeah?
How does an Advantage plan compare with right now with self-employed that your own employer?
It depends on what meds you're on and everything else. We run it opposite exactly what you're paying and exactly what we think you're going to pay for the current diseases you have. And I can't say in most cases the Advantage plan fails, because that's not true. So that's what we do, is we do your monthly cost and then we do your annual. And the most important thing to us is the annual, because cash flow may be a problem for some, and in those cases sometimes we put them right in an Advantage plan, okay? But the actual thing that we should be looking at and you should be looking at is the annual outlay of your money, okay? And the ease of getting the care. If you're going to be traveling to the mainland, most of the Advantage plans will cover you for emergencies, etc. If you want to go to Mayo Clinic, you can go to Rochester on a PPO Advantage plan, but they will not take you at Mayo Clinic Arizona, and they will not take you in Mayo Clinic, Florida. They don't like Advantage plans. Why? Pre-certification. Did you ever try to get a pre-certification from Hawaii in an emergency when you're on the mainland? Good luck. It's a different time zone. Most of the time they're sleeping in Hawaii when you're having your emergency surgery.
So you don't have those problems with the Medicare, Medigap plans at all?
No, but they may be more expensive. So you have to actually balance out what's costing the most. That's why I said it's totally individual. When people say to me, I like my husband's plan, I'm going to go on, and I go, you know what? this is going to cost you $20,000 a year. Your husband's paying $1,000. Don't do it. You can get it for less. Do it this way or whatever. You never just go with. And I'm guilty of that too. I called my friend. I said, "What'd you pick?" So it would have been a mistake for me to pick that. Yeah, I'm getting the note. 5 minutes. I have to close. Okay, so we're going to tell you. Well, I already told you how we decided. MD acceptance we went into. Current or future residence. If you want to live near your grandchildren, think more original. Okay. And the biggie is medication. So, because you're lawyers, I changed my joke. And this is Ruth saying, "What is it about Medicare you don't seem to get?" in my New York accent. Okay? I have questions, because you don't get out of here without questions. True or false? Income-related, this you should get easy. Income-related surcharges to income, right? Apply to Part B only. False. What other part do they apply to? D. All of you are so smart. Okay. All doctors must accept Medicare patients.
No.
Right. Supplemental acceptance is guaranteed. That's Medigap. For the first 6 months after you are 65. True. True or false? Medicare routinely covers all vaccines and hearing aids. Good. Okay, Medicare Advantage plans require more pre-approvals than original Medicare with supplemental. Right. The income-related monthly adjusted amount is based on your gross income from 2 years prior. False. Wow, are you smart? Okay, I thought that was my good trick question. It's based on your modified adjusted gross income. I didn't think any of you would get that. Okay. You must sign up for Medicare B at age 65 to avoid a lifelong premium penalty. Yes. False. You can work. You have employer coverage, right? Your spouse can work. You have employer coverage from him or her. Advantage Medicare policy premiums have stabilized, but coverage is the same or better. Right. It is false. Okay, I'm open for questions. I think we have 3 minutes for questions. Any questions at all?
Where do you find out about these individual Medicare, A, B, C, D, M?
Well, yeah, there are many websites that have all of the information. You can.
Those are offered by individual insurance companies?
They are. We usually run spreadsheets on them. It takes a while to do. It's really quite an extensive research, but we're used to doing it, so it's faster. It takes us about 2 hours to do a patient that's moderately, got a lot of medications or whatever. That's a typical amount. Yes, any other questions?
So you mentioned that the vaccines are covered under D.
Some are D, some are B. Some are B. Pneumococcal vaccine is B. D.
Now there's the supplemental insurance.
Has nothing to do with drug. Only A and B. Okay.
If you're turning 65 this year and you're planning to work for another 5 years, basically do nothing.
Yeah, well, you have to tell them that you want to defer B. They're going to
You
order.
gotta tell them.
Yeah, if you're on, are you on Social Security already? No. Okay, so you don't have to tell them anything. Just don't sign up for it. But if you're on Social Security, they'll automatically enroll you in A and B at age 65. Any other questions? I did. I mentioned COBRA. COBRA doesn't count towards being employed.
Your last comment, but if you have told them at 65 that you're going to defer and not collect any of your, then they haven't automatically enrolled you.
They might have if you told them late. You know what I mean? Yes, they might have.
You did it
Yeah, you'll get a Social
I'm
Security.
employed, I'm covered by employer insurance.
Right. When you
I don't want to do anything now.
Right. They will automatically enroll you if you're 65 in 66 in Social Security. So you need to tell them at that time, if you're receiving it. They'll automatically enroll you if you're receiving it. So you need to tell them you want to defer it. Okay? Does that clear that up?
Well, if you tell them that you want to, you specifically tell them in a timely fashion that you want to defer getting paid Social Security. Has that also then deferred enrollment in A and B? Or they've gone ahead and?
Sometimes they've gone ahead. Sometimes they've gone ahead. I've seen
They
that.
shouldn't have, huh?
Well, I don't know that they shouldn't have, because most people will get the card and immediately call and say, I'm still working, unless they don't know they can defer B. They might do it. Yeah. And someone else have a, yes.
I have a question. You had mentioned earlier that after 6 months in Advantage plan, you're not guaranteed Medicare coverage.
No. Advantage plan has nothing to do with Medigap coverage. In the Advantage plan is a built-in coverage that's partially Medigap coverage.
Yeah,
but that no. If you want to go to original,
yes,
right,
and get
and supplemental, you can't. You have to be underwritten after 6 months. They could decide not to underwrite you. I just had a lucked out patient who had all this stuff wrong with them. It was awful. I said, they're going to underwrite you. And they said, they didn't underwrite me. And guess what? They were a doctor. I said, wow, that is great. You know.
But to go back to the original, so it's 6 months of enrollment in an Advantage plan. And after that 6 months, you want to go back to the original Medicare?
No, let me go. If you originally sign up for an Advantage plan and you stay in any amount of time, anything over 6 months past the age of 65 or past when you first enrolled, you would now be subject to underwriting if they choose to do it.
Okay, so the confusion that I have is in your true false questions, question number 3, supplemental insurance acceptance is guaranteed for 6 months after 65. Is it age 65 or is it 6 months?
You know what? I think you just hit on something.
That is wrong answer to your question.
Okay. It is guaranteed for the first 6 months after you are 65. But in addition, that is true. But in addition, it is guaranteed for the first 6 months after you quit your job and sign up for Medicare B for the first time.
Okay.
Okay? Sorry about that. Okay. Everybody else? Yes?
What changes do you foresee might happen in 2019 or 2020?
I have no. I'm telling you, I was looking at that this morning because I got the new numbers for the Irma. Okay. With what's going on now in this country, it's kind of hard to predict what's going to happen in the next 2 hours. I don't know.
No, it's very predictable, really.
Oh, really?
If you were in the top 1% and our current president's friend, your way is covered. Everybody else is screwed.
So you as attorneys might be good.
We're all on the way. The Gestapo will be looking for us.
We're not going to get into politics because we've been thrown out of many New York restaurants because of my husband's beliefs, who are antithetical to mine. So I would say we don't discuss this at this meeting. Okay. Well, thank you very much. I'll take questions after.
She was really good.
I'm finally doing
I didn't get a bunch.
Good.
Getting out of it.
Okay, Shirley, you take care. See ya.
I have a question. I have a question. My wife, I'm under an employer plan. It's under me, and so is my wife. She's an attorney. I took Social Security. She took